Poor kid. But but that's a great program, and you know, these kind of issues, mental health issues, stress, all this things that are going on with these kids, it definitely affects their schoolwork. We've got Shelley Poerio from Living Free Health, who also, is a counselor for and has a drug treatment program. These things can, cause a lot of issues with the family, with the parents, with whatever stress that they're going through. So this is something that you guys are hearing about or dealing with right now?
Yeah, absolutely. I think one of the biggest problems that we're seeing for people who are in recovery and trying to stay in recovery is dealing with the isolation that the quarantine is kind of forced upon us all. So when we see people when we advise people for sober social support to go to 12-step meetings, to be engaged in therapy, some of them are fearful to come in for therapy. They're not sure what's going on. So their anxiety and stress levels have increased greatly. What we've attempted to do is to have CDC compliant 12-step meetings in our treatment, and also to offer telehealth options. But I think the biggest thing for folks in with regard to addiction recovery and mental health is finding a way to stay connected and to stay positive and maintaining hope, because as Alicia stated, there's a lot of fear and uncertainty, and that feeling that this is all out of my control. How do I deal with this? How am I going to be able to cope, right? So what we're trying to encourage people to do is to step up those coping strategies, especially considering that isolation is often the biggest trigger of all for people, and is often an early warning relapse sign. I know that my sponsor always told me, Shelley, your disease wants to kill you, but first it has to get you alone. And so this is kind of, with the sort of forced isolation at this time, it makes it more challenging for people in recovery.
How